Botox for jaw pain. On the Health Watch tonight, a growing number of people have trouble related to grinding and clenching. Many are finding relief with the popular cosmetic treatment.
Health reporter Stephanie Stahl is here with more on how this works.
Yes, lots of people happy with this. You know, Botox is often called the poison that cures, most popular for easing wrinkles, but it's also used to treat other things like headaches and excessive sweating. We'll now add TMJ to the list.
Looks a little bit more bulged out.
Rudy Gibson says TMJ can make her face look distorted, and the inflammation in her jaw also makes it difficult to talk at work.
And then it sends kind of a pain up the sides of my head, and it tenses all of these muscles in here.
TMJ is an inflammation of the temporal mandibular joint, which is the joint that allows you to open and close your mouth.
Dr. Shaima Abdullah with Rittenhouse Dentists in Bryn Mawr says she sees patients every day who have problems related to TMJ and the grinding and clenching that goes with it, usually while people sleep.
People a lot of times will wake up with headaches or jaw pain, tension in their jaw. Sometimes when it's really bad, they'll even have a locked jaw.
Remedies that Rudy and others have tried include anti-inflammatories, muscle relaxers, and bite plates, but they often don't work. So Rudy decided to try Botox injections.
All right, Rudy, one last time. Open, close, and clench. So Botox has always been used to treat muscle spasms, and that's actually the primary use of Botox, which a lot of people don't realize because they think, oh, I'm going to get Botox to treat wrinkles.
The Botox is injected into the jaw area to relax the muscles associated with TMJ.
And I was pretty amazed by the results. It was actually overwhelming, the feeling of relief.
Dr. Abdullah says Botox is the only thing that she's seen that's 100% effective with no side effects.
I was so impressed, especially for patients that would come in and they would be like almost crying because they were in so much pain. And then I would see them 2 weeks later and they were like a brand new person.
Now, the NIH says while safe and effective, Botox has not been specifically approved to treat TMJ. Rudy says, though, it has turned her life around.
I'm sure it
big
has.
time.
We're all over here going,
Ooh, I heard the whole time, yeah.
yeah. All right, Steph.
Ooh, thanks, Steph.